Yeah, so the ANIMATE trial was a phase 2 study that we did in the UK. It was looking at relapsed refractory classical Hodgkin lymphoma. And what we did is we took patients who were at first relapse, so they were relapsing after ABVD or escalated BCOP-DAC or whatever. We registered them on the study. They had first-line relapse chemo, so that could be whatever the investigator wanted, GDP, ESHAP, etc., ICE. And then they had a PET scan, and if that PET scan was negative, that's great. They would come off study and have an autograft, essentially. They all had to be stem cell transplant fit. However, if the PET scan was positive, so in other words, they'd failed their first-line relapse chemo, then they went on to Nivolumab. So it's really assessing the utility of Nivolumab in a transplant-fit population when their first-line relapse chemo didn't work. And what we showed is that the response rate there was 40%, well, just over 40%, which is a bit less than we expected. What was very interesting, though, is for those who didn't respond and needed subsequent treatment, often their response to subsequent treatment was much better than the chemotherapy they'd had before. And that speaks to this sort of chemosensitization that you see with PD-1 inhibitors. In fact, of the sort of 31 patients who went on to Nivolumab, 25 did eventually get to a stem cell transplant, which is a very high rate. And of those that were autografted, we haven't seen a single relapse yet. So with relatively modest follow-up, so obviously we'll keep an eye to see if there are any relapses in the future. But again, I think that speaks to the chemosensitization that these agents can lead to. So whilst the response rates were modest, I think it does sort of highlight that these agents are really important in the relapse refractory pathway.